Hey guys, I'm Natalie Friels, and this is the HealthTech Hotseat. I'm joined today by Dr. Kate Groff. She is a DNP and faculty member at Johns Hopkins University School of Nursing. Our interview talks about the essentials of educating healthcare professionals on innovation, clinical AI, implementation, and evaluation, as well as what it means to be a patient ourselves, especially a mom or a parent of a patient, and how that has informed her clinical and non clinical work. I think today's interview will really resonate with a lot of our listeners, especially those who are in the nursing profession. And without further ado, here's my interview with Dr. Kate Groff.
Hi guys, it's Natalie. We are here at HIMSS 2026, and I am joined by the absolutely wonderful Dr. Kate Groff. This is the Health Tech Hot Seat. So, Kate, we were just talking offline, but you told this awesome story about your work with the Johns Hopkins DNP program.
Yeah.
And what you're building out with their, innovation pipeline education.
Yeah.
And you said something that I was literally just talking again about today. There's not enough innovation education in the, medical education, nurse practitioner or PA or
Yeah.
nursing education,
Sure.
or really any bedside clinician for that matter.
Yeah.
So, why do you think that is? And should we be angry that that is the state of nursing education? And then what should we do about it?
Yeah, absolutely. So I think it's a lot of what I would have wanted to learn when I was going through nursing school. I really was eager to learn more about innovation, how to get involved. And it just wasn't created at that time. We didn't have a lot of nurses involved in the field, and that is changing. Now we have a lot more nurses, PAs, other healthcare professionals that are involved in tech. And we want to bring that earlier in the pipeline to nursing students, PA students, any health profession, to really try to train students to know how to handle technology in the real world. How do you use your evidence-based knowledge as a nurse to evaluate new technologies and really make sure that you would recommend them to patients and families that you get to care for? And how do you really look critically at those technologies and decide whether or not you would recommend them?
What would you say is one of the bigger pitfalls when you're evaluating a tech like that?
I think it's difficult for nurses coming from, learning about evidence-based nursing and wanting to have a lot of evidence and knowledge before they're willing to really evaluate a technology. And a lot of new technologies don't have evidence yet. And so it's challenging because a lot of early startups they don't have a nursing voice or a clinician voice on the team. They don't have someone to do the research to produce the white papers and case studies to build that evidence. And so I think it's a really great opportunity for healthcare professionals to get involved, to really advocate for the importance of evidence and kind of combine those two fields and say, the more evidence you can provide, the more likely it is that your technology will get adopted by health systems.
Yeah, that's such a great point. What do you feel like when you, Dr. Groff, goes to evaluate tech, what is a red herring that this team or this founder or this organization did not involve clinicians enough or did not involve patients enough? What's a glaring thing that you see?
Yeah, I think when it doesn't mesh with the workflow, when it adds steps, it adds clicks, you can tell that they didn't involve clinicians in the design and implementation. And so you really need patients, you need clinicians involved at the very early stages of product development, all the way through commercialization, to make sure that that patient red thread goes throughout and that it's not lost in the spirit of rapid commercialization that often happens with healthcare startups. And so how do you get nurses involved? And I think part of it is us doing a better job of training nurses to really advocate for themselves, their patients, their families, and making them feel confident in using their voice so that they can talk to health tech companies, whether they're sitting on the health system side evaluating them, or they're actually in the healthcare company, they're advising or serving on, the board or whatever role they want to play, that they feel comfortable and confident really advocating. And so that's been my passion, is really looking at, how do we get patients involved? How do we get clinicians involved in early stage technology so that that voice is really heard?
Yeah, no, absolutely. And I feel like it's so clear. Once you have worked with tech enough, you can see different aspects of the way they talk about it or just the way it's designed. And you're kind of like, I don't know if I don't know if somebody has cooked here yet. I don't know if you've really gotten it yet. What is one of the most frustrating maybe categories of health tech that you keep seeing built, or things that you were like, why is nobody building in this space right now?
Yeah, I think the area that I'm most excited to see building would be in rural healthcare. There's a lot of new policies and programs coming down the pike to really increase access. I think a lot of companies don't build in that because it's incredibly challenging. It requires a lot of partnerships to work together because it's increasingly difficult for one company to serve all the different purposes. And so I think what I'm excited about is really delving into that. We want to challenge these access barriers to care and really help patients get to their appointments and follow up with them, whether they live in inner city Chicago or in rural Illinois. We can get access to them and really engage them where they're at. Because, as busy professionals, we know, or busy parents, we know that healthcare doesn't happen during the 9 to 5 when you're free. It happens when you need to get your kids to school or you're sick yourself. And, how do you really decrease those barriers and help families? Because so many families are struggling with accessing healthcare, and we need more people to work together. And I think, a lot of digital health drives competition, but really it's partnership. In the end, that's going to get it done.
There's so much that you do. Like, what do you not do, right? You're a doctor of nursing practice, right? And you're on faculty at Johns Hopkins. And, something about your story that I really want to highlight, if you're okay talking about it, but your experience, not only as a nurse practitioner, but as a caretaker for your son when he was so sick. And how I just would love to hear how that experience has really shaped your trajectory. Clinically, and then also, in the non-clinical work that you do.
Yeah, sure. So as a clinician, I was a nurse practitioner in the ICU, was doing research on patient and family-centered care and how do we really support not just the patient, but the siblings of the patient. Older children often get lost in the shuffle when a younger sibling is ill, and the parents, grandparents, pediatrics is about the whole family unit, and how do we better support that entire family unit? But it wasn't really until my own son was sick and in the hospital during COVID, he was in the ICU, that I really experienced it firsthand. And, it's unfortunate that oftentimes we don't appreciate things until we experience them firsthand, but it really opened my eyes even more to the struggle of patients and families. And it really made me dedicated to patient and family-centered care. And how do you translate that into technologies and really bring that care into the future? How do we keep people connected? My background's in pediatric stem cell transplant, and those patients are often very cut off from their families because they're inpatient for many, many months. And so you think about patients like that. How do you keep them connected to their loved ones? How do you use technology for the betterment in pediatrics, but also in general practice? And so that's been really my passion. That's been a thread throughout my career, whether it's working at the bedside or in academia or on the tech side, is how do you really make sure that at the end of the day, you're really serving the patients and families and making sure that they have a better experience, because we all know all the challenges. And so I think to maintain hopefulness that we can make healthcare better, we have to look for the opportunities. And, I think HIMSS is a great way to connect with other companies. We're all running fast all the time at a mile a minute, and we often don't take the time to slow down and really think about how we can partner together and work together. And so this is just a great opportunity to really get face to face and see how we can help each other.
I that's what in-person is all about, right? And you said earlier, like, also the need for other clinicians who are in health tech to be in person, to be face to face, and learning how we navigate this space, because like we said at the beginning, of our time together, there's not a lot of formalized education for how clinicians navigate this role. And what we're uncovering more and more is it's so essential that we're at the table. Last question before we do our rapid fire, but you mentioned, about the patient experience. I was at this awesome talk this morning, and it was about reframing value around patient experience. So when you think about value proposition for product, what does patient experience mean to you in terms of value proposition?
Oh, I love that question. Yeah, I think when I think about patient experience and product development, I think about, are we speaking in the language of the patient? Is it appropriate for their reading level? Are we using words that they understand? Are we providing opportunities to, further describe whatever words we're using that they might not feel comfortable with? Is it multilingual? And so being multilingual and available on multiple different channels is really important, because, in the US, we use a lot of text, we use a lot of web, but in other countries, they use a lot of different systems. And so it's, WhatsApp. Can we get on WhatsApp? Can we engage patients there?
Are we meeting them where they are?
Exactly.
Yeah. Wow. That's good.
And, a lot of conversations today have revolved around the how interesting it is that patients will feel more comfortable engaging digitally than they often will in person. And, as a clinician, I understand that, like, certain sensitive topics patients just don't want to talk about in person. But if you do a digital intake and engage them there, they might reveal something that's really important to their care,
Sure.
but that they might not want to reveal in person. And
Yeah.
so I think the goal is always to make sure that that stays aligned and that we're really getting good engagement on the patient side so that the technology really does what it's supposed to do and doesn't get, shoved into a drawer as some do. We know as nurses, as clinicians, that often happens. And so how do we always keep track of that and stay on top of it to make sure that patients are using it? And how do we get feedback from them, from our customers, to make sure that we're meeting their needs?
Yeah, I love it. All right.
Yeah.
We have Dr. Kate Groff, and she is in the HealthTech Hotseat. We have rapid fire real
Okay.
quick. Okay. What is one AI hype that you're going to call BS on?
Ambient AI.
That's a hot take. Well, that's good. Okay. We just don't think.
I think it's a flooded space.
Yeah.
I think it needs a lot of work, especially for nursing workflows. I'm excited about some of the progress I've heard here at HIMSS about specifically helping nurses. I think we need the keyboard in the background. And so whatever company can do that, I'm excited for that. But I think there's a lot of challenges.
I like it. Okay. What AI hype are you about? You're all in. You think it's legit?
Voice.
Voice.
I'm excited for voice. I think it's the next thing to really transform healthcare.
Nice. And okay, last question. If you could go back and talk to yourself, nursing self, 10 years ago, 5 years ago, what would be one piece of advice you would give her?
Don't limit yourself to working at the bedside. Be brave enough to think how you can contribute in other areas and step outside the bedside. And you can still be a nurse and not work at the bedside.
That's awesome. Thank you so much for your time.
Thank you so much.
Everybody, this is Dr. Kate Groff. She is a doctor of nursing practice. She's on faculty at Johns Hopkins. We'll link her stuff below. Thank you so much for being in the HealthTech Hotseat.
Thank you so much.
I hope you guys have enjoyed today's interview with Dr. Kate Groff. I'm Natalie Friels. This is the HealthTech Hotseat. See you next time.